Dr. John Kazim. I am the periodontist here at the Dental Academy, Delhi branch. So I bring you to one more enlightening video about the periodontic series. Today, as you see, I have all the instruments regarding your mouth mirror, probe, explorer, the typhodont jaw set. So today I am giving you a small insight about what is the probing, how is the probing done in the normal patients, clinical patient diagnosis, and it will help you further in diagnosing your all daily patients in your OPD. So what is the probing depth? Whenever a patient comes to you with the bleeding gums, most commonly patient has a problem of food lodgement, bleeding gums. He has a crown and now the bleeding starts. He has some bridge and a filling and the bleeding starts. So what is the first thing you do? Or also when you do crown cutting. So what the first thing you do? You always take a probe and you measure a normal probing depth. Now understand what is the normal probing depth. The space between the cervical enamel junction and the bone. Okay, some people also call it the biological width. So space between the cervical enamel junction and the bone, that tissue depth is called your normal probing depth. Okay, if I can show you inside the video, if I put a probe example here, just I'm putting a random video, okay? So if I put it by here, so this goes inside straight and here it stops. So the space between the CJ and the bone where the probe is going, it is called the normal probing depth. And what is the space inside this called? The space inside is called the crevice. Earlier it was called sulcus, now it is called crevice. Okay. Second, when you do start the probing, always remember you have 3 points on each and every tooth. Mesial, mid-mesial, distal. Come toward the lingual side, lingual, mid-lingual, distal lingual. Might be any anterior tooth also. When you start, mesial, mid-mesial, distal. Go down the palatal side, mesial, mesiopalatal you can say, mid-palatal, distal palatal. Always if you want to measure probing on any teeth, what is the probing depth? Always measure all the 6 points. This is the William probe. You must have heard, it's a very common probe used in your day diagnosis. This is the William probe. The markings are 1, 2 and 3, 5, 7, 8, 9. 4 and 6 are missing in this probe. Okay. So example, if I want to do probing on this molar, I will say imagine on this